Okay, now let's have a look at how the thorax moves to allow us to breathe or respire. So now let's have a look at how the ribs move to cause inspiration. So the upper ribs move like the handle of a pump. So if we look at it from side on, when we breathe in, the ribs will elevate, swing forward to make the sternum move forward. So movement here is occurring in the sagittal plane. So the ribs are elevating anteriorly to bring the sternum more anterior and superior. And this will increase the anterior-posterior dimensions of the thorax. And as this is occurring, the more inferior ribs will move more than the more superior ribs, just because they have greater leverage to move. So the upper ribs are helping the sternum to move anteriorly and superiorly to increase that anterior-posterior diameter of the thorax. Now if we look at the lower ribs, these move much like the handle of a bucket. So the ribs are now swinging laterally, so they're moving in the coronal plane. And so this will elevate the ribs laterally. And this will increase the transverse dimensions of the thorax. And again, due to the greater leverage, the inferior ribs will move more than the superior ribs in the coronal plane. So while the upper ribs are helping to move the sternum anteriorly and increase the anterior-posterior dimensions of the thorax, the lower ribs are swinging out in the coronal plane, increasing the lateral dimensions of the thorax. So together, all of the ribs are helping to increase the volume of the thoracic cavity to help force air into the lungs. So during passive breathing, most of the work is being done by the contraction and relaxation of the diaphragm. However, for forced inspiration, the diaphragm is lowering, so that's going to help increase the height of the thorax. But the ribs are also going to swing anteriorly and laterally, and this will help to widen and deepen the thorax. So anything that increases the volume of the thoracic cavity is going to help us breathe in. And then to get all that air back out again, we want to decrease the volume of the thoracic cavity. And this is done through that elastic recoil of the diaphragm moving upwards, and muscles helping to lower the ribs to make the thorax more narrow and more flat. So therefore reducing the volume in the thorax and forcing air out of the lungs. So I mentioned how accessory muscles of respiration are particularly useful for forced inspiration and forced expiration. And some of the most important of these accessory muscles of respiration are our intercostal muscles, so the muscles found between each rib. Now, all of these intercostal muscles are originating from the inferior border of the rib above and inserting into the superior border of the rib below. And all of these muscles are being innervated by the segmental intercostal nerves. And there are three layers of intercostal muscles. The most outer layer is our external intercostal muscle, and the arrangement of these muscle fibres is in the directions of hands in pockets. So as they move inferiorly, they move more anteriorly. And these external intercostal muscles are vital for forced inspiration. They help to expand the diameters of the thorax to help us breathe in. The next layer deep to the external intercostal are our internal intercostal. And the fibres of the internal intercostal muscles run in the opposite direction to the external intercostal muscles. So they're perpendicular to them. And because they're perpendicular to them, they'll have the opposite action. So the internal intercostal muscles are predominantly useful for forced expiration. They help to reduce the diameters of the thorax and force air out of the lungs. It is probably useful to know also that some of the internal intercostal muscles, those ones that are between the costal cartilages, are actually going to help to expand the thorax, and so are then useful for forced inspiration. But most of the internal intercostal muscle fibres will be useful for forced expiration, squeezing the thorax to force air out of the lungs. And the most internal layer of the intercostal muscles is our innermost intercostals. And these have the same orientation and the same action as the internal intercostal muscles. That is, they're helping with forced expiration. Now, it's important to realise that there are many other muscles that are helping to either increase or decrease the diameters of the thorax. So any muscle that is attaching to the rib cage, so say serratus anterior or our scalene muscles, our pectoral muscles, they're all vital for forced breathing. They'll either help to expand the volume of the thorax or depress the volume of the thorax. And just quickly, we'll have a look at the neurovascular bundles providing blood and innervation to the muscles. We have the rib above, we have the subcostal groove underneath it, and we have an intercostal vein, artery and nerve being protected by that subcostal groove. And they run between the layers of internal intercostal and innermost intercostal. So the question for debate on the LMS is, where would you insert a needle if you had to drain the pleural cavity? If, say, you suspected someone had pneumonia, had a bit of an infection in the pleural cavity, where would you insert a needle to extract some of that fluid and test it? So you can read more about the muscles of respiration by consulting your prescribed textbook, the study guide and your principles document. This is Dr. Lloyd White. Thank you very much.